So today we're going to talk a little bit about stakeholders' perspectives. And this is a study that was funded by the P2P project. It was a small grant that we received at the University of Ottawa when I was a postdoc there. And I did it with Drs. Elena Niederman and Dr. Avi Bourgeau. And we interviewed stakeholders about what they thought the role of international students in the health professions is in Canada, as well as what they thought the institutional barriers they face in the process of immigration and professional integration, and the facilitators of their integration, including the identification of promising practices. And I haven't put a lot of words on slides because I've spent the last semester teaching my students to use the Pecha Kucha, which is 20 slides, 20 minutes. So we have a lot of pictures and not a lot of words. So you'll have to listen to me, but it is a publication. I'll give you the reference at the end, and if you're interested, you can pull it up. So my work focuses primarily on health professionals, and I focused a lot on internationally educated health professionals, and this question arose out of that research. The movement of international students reflects the general patterns of migrations, which are complex and nonlinear. The top destination countries for international students are the United States, the United Kingdom, France, Australia, and Germany, while China and India, Korea are the top sending countries. However, countries like China and the United States are in the top 10 host and sending countries for international students. So we have a circle of migration. Research suggests that international students study abroad to receive high-quality education, enhance their chances of obtaining a better career, or to see the world. And many students plan to stay in the host country either temporarily or permanently. International students' age, local training, familiarity with the native culture can facilitate fast integration into the host country's workforce. Some states develop policies that ensure rapid integration of international students, while others may be more restrictive. But an overly warm welcome can construe a form of unethical recruitment. Reflective of an infamous phenomena of brain drain, presents a significant problem for countries from which the students depart. Some students return right away upon completion of their studies, others return eventually, or remain in the host country and provide financial contributions by sending remittances to their families back home. This complex interplay among structural, institutional, and personal factors that shape international students' decisions to remain or return home after studies remain poorly understood. The role of the host country's policies and practices about migration and integration of international students has been the focus of little research. However, research is important because it illuminates how host countries and institutions respond to the needs of international students and how they navigate the symbolic line between border protection, human rights, and the unethical recruitment of immigrants. We address this gap by examining how Canadian stakeholders, members of federal and provincial immigration, education, and professional bodies perceive migration and integration of international students. We identified 11 stakeholders from an extensive review of the academic and gray literature and internet searches of leading organizations that work with international students, as well as by relying on the advice of some personal contacts, people with knowledge of the topic and whom we knew from previous research. They were representatives of provincial, federal ministries of immigration, educational and training institutions, and host countries' international students, health professions, regulatory bodies, and professional associations, and we interviewed an immigration consultant. We chose these specific stakeholders based on their direct involvement in the policies and practices related to migration, professional integration, and certification of international students, immigrants, and internationally educated health professionals. The stakeholders were asked to comment on their role in their organization in the process of integration of international students, as well as their perceptions regarding the barriers and facilitators about international students who plan to settle in Canada and work in professional field. Focusing on the healthcare sector, the segment of the Canadian workforce that experiences chronic human resource shortages and prompts international recruitment for this study, we focused on the following research questions. What role could international students play in the health human resource sector in Canada? What institutional and structural challenges do international students face when seeking professional integration in Canada? And what are some of the facilitators that enable an ethically sound approach for migration and professional integration of international students? There was an overwhelming agreement among the stakeholders that international students bring many advantages to the Canadian society. The official immigration policy in Canada emphasizes the importance of immigrants for enhancing cultural and ethnic diversity in the Canadian population. The stakeholders identified this as a critical contribution brought to the international students. International students have also been seen as possessing additional advantages that were not available to immigrant health professionals. By spending several years in the Canadian university, international students obtain cultural competency and bypass the long and often cumbersome process of credential verification and accreditation. However, it was also stressed that we should not overestimate international students' integration into the Canadian society, as their ability to skillfully navigate the complex terrain of professional integration is challenging. In that living in a university environment, they are not widely exposed to Canadian society, and they often lack the language proficiency and knowledge about immigration system, which can be significant barriers for some international students. Two main themes arose from the data. A cautious invitation of international students in the health human resources in Canada. Stakeholders did not see international students as the answer to the health human resource shortage in Canada, because it isn't a shortage, but really a maldistribution, in that there is a need for rural and remote areas, and similar to most immigrants, international students do not seem to be ideally situated to fill gaps without specific interventions or clear recruitment strategies. There's also ethical concerns, as there is a fine line between being a welcoming country and luring students to stay. Although there are students who plan and want to stay, it can be problematic to treat all students as potential immigrants. Besides, international students who return may become ambassadors of Canada, who attest to the quality of the education and that promote Canadian cultural values abroad. Only 10% of international students choose to study in a health field, and only 50% of those students choose to stay. Our analysis revealed that stakeholders noted a largest barrier as a policy disconnect at the juncture of the services offered by the educational institutions, professional associations, and immigration policy. For example, educational stakeholders perceive the educational institution's mandate is to deliver education and not to assist students with applying for permanent residency. However, it was also noted that international students bring considerable revenue to the Canadian education system and are a valuable asset to Canadian universities. But federal and provincial institutions take a back seat to facilitating the process of integrating those students who would like to stay in Canada. Our analysis revealed that post-secondary institutions independently decide how much they would like to be involved in supporting international students who want to stay. Some develop partnerships with immigration bodies, but this can be further complicated by who is permitted by law to advise about immigration, leading to some universities hiring registered immigration advisors. Questions arose if educational institutions should or could do more. These stakeholders acknowledged that international students were a highly desirable group of potential immigrants, but they were concerned about the dangers of unethical recruitment and being perceived as poaching the best and the brightest. Immigration stakeholders identified a number of pathways that international students can take to apply for permanent residency in Canada, and we probably all know them. The general application for skilled worker, the provincial nominee program, the Canadian Experience Class Express Entry. Although potential valuable immigrants, international students were not seen as a group of individuals who warranted a designated or a unique route for immigration. Immigration policy that strives for clear, transparent, and accountable and a fair process to all applicants. Some immigrants stakeholders believed some policies for permanent residency can disadvantage international students who want to stay and work in Canada. Immigration stakeholders did acknowledge students can lack information about the immigration process and pointed out there were a number of initiatives that exist to provide international students about navigating the immigration terrain in Canada. There's also substantial information available on the internet, which is accessible to students. The disconnect between different stakeholders was also evident with the healthcare stakeholders, as crucial informants noted that they do not see international students as a separate group of applicants or members. For example, regulatory bodies base assessments for professional certification on the credentials and qualifications of the applicant, while professional associations grant membership to all qualified, regardless of the place of birth or where they were educated. Despite the logical and fair approach, these policies can create additional barriers that disadvantage international students. They may not have the sufficient language skills, they may not pass the licensure exam, but they may not have permanent residency status. They may also work with a work permit after studies, but have little understanding of the healthcare system and how to navigate it. They may also have to have better language skills than other immigrants, but they still need support in filling out applications for permanent residency, despite the fact that many international students have lived in Canada for quite some time. They still may not have the same knowledge about the process of professional certification. In summary, our analysis revealed that the barriers and facilitators among the three communities most intimately involved with international students. They are cited here. Barriers for integration: services are provided in an ad hoc fashion. There's a lack of access to information. The facilitators for immigration in the education community were timely access to immigration counselors and to information about the immigration process. The goal of the immigration communities are the barriers of integration, express entry system requirements, and the lack of access to services for newcomers. The facilitators were that the access to information was online and the programs target international students. The goal of the healthcare community were that there was a lack of recognition of the unique sets of skills that international students can bring, and the access to information and services and the transparency about licenses in job markets were considered facilitators. Our findings indicate that policymakers view international students as an attractive group of potential immigrants. International students are seen as having an advantage over immigrants, but there's a reluctance by some stakeholders to see international students as immigrants. Promising practices do exist, but they are predominantly local or regionalized, and the information about their effectiveness is lacking. Given that our study provided insight from a relatively small number of stakeholders and focused on the health human resource sectors, an area where Canadian policy is particularly sensitive to this issue, this finding could be interpreted with caution. Some areas for future research are that can be addressed, the limitations, by using some larger samples and comparing policies across different labor sectors and across jurisdictions within Canada. These comparative analyses would capture possible differences in the experience of international students from different provincial contexts could also be valuable. And we're doing that now with a very small SSHRC funding that we've received. Given that international education is projected to grow and that countries compete to attract international students, it's vital that we start a dialogue on how to make international students feel welcome in their host country without poaching or draining other countries of their human capital. For more information, you can read the article in depth. It's published in the Globalization of Society and Education this month. Thank you.